Good evening, ladies and gentlemen. On behalf of the Ministry of Health, Wellness, and New Health Investment, I'd like to thank you for taking the time to join us for this COVID 19 press briefing. Permit me to acknowledge the Minister of Health, Wellness, and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Letitia Lestrade-White, Chief Medical Officer Dr. David Johnson, Director of Primary Healthcare Services Dr. Laura Esprit, National Epidemiologist Dr. Shalauddin Ahmeh, the Road Manager and Events Coordinator for TK International, James Rodney, of course, our media partners, and you, the listening and viewing public. Good evening once again. This evening, you'll notice that the theme throughout the press briefing will be the COVID-19 vaccination campaign that has been rolled out here in Dominica. Of course, as always, we like to keep tabs on the statistics, and so we welcome our national epidemiologist, Dr. Shalauddin Ahmeh, to begin the press briefing.
Honorable Dr. Irvin McIntyre, Minister for Health, Wellness, and New Health Investment, Mrs. Letitia Lestrade-White, Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Dr. David Johnson, Chief Medical Officer, Dr. Laura Esprit, Director of Primary Healthcare Services, Ms. Sheena Harry, Communication Officer, Mr. James Rodney, Road Manager Events and Events Coordinator, TK International, media and listeners, good evening. It is my pleasure to present to you the epidemiological update. As of today, our active cases are 14, total recovered cases are 146, and to date, there is no death due to COVID-19. Among the active cases, 11 females, 3 males. Their age range between 19 to 69 years, with a median age of 30 years. All of them are imported ones. Of these 14, 7 of them are non-nationals. 12 of them were detected through our day 5 testing, and 2 were detected on arrival at the airport. 4 had mild to moderate symptoms during admission, but stable now, and 10 of them are asymptomatic. Concerning the vaccine campaign, it is ongoing. As of yesterday, we have completed 14,583, which is about 31% of our target population. Our target population represents 2/3 of the entire population. In order to achieve herd immunity, we need 100% or near 100% of the target group vaccinated. Why do you need this COVID vaccine? If you are vaccinated, you are less likely to get infected or transmit it to others. Let me elaborate on the function of COVID vaccine in our body. Once we introduce the COVID vaccine inside our bodies, it stimulates our immune cells to produce antibodies specific to the viral protein and memory cells. These are B cells and T cells. Then, if we do get exposed to COVID-19 after vaccination, these specific antibodies will prevent the virus to attach to our cell receptors. And this will prevent the virus to enter inside our cells, consequently will prevent the virus replication. Without this replication, there won't be an adequate quantity of virus to infect our body or shed and subsequently transmit it to others. Therefore, if you are vaccinated, If you are vaccinated, you are less likely to walk around with this virus in you. Remember, given the asymptomatic nature of this virus, without the vaccination, a healthy individual can be a host or virus factory and continue to transmit it to others unknowingly. Our second objective is to achieve the herd immunity, meaning community level immunity. Without the herd immunity, our normal way of life will remain restricted. No gatherings, no festivals. Travel in and out of Dominica will remain somewhat regulated. Our third objective is to keep our economy going. The vaccine is the only realistic chance of opening our tourism sector and our economy going. Now, a bit of safety of AstraZeneca vaccine. I would like to highlight some quotes from the various agencies in this regard. AstraZeneca company published an update on the safety of the vaccine on March 14, following recent concern raised around thrombotic events, which states that, and I quote, "A careful review of all available safety data of more than 17 million people vaccinated in the European Union and in the United Kingdom with COVID-19 vaccine, AstraZeneca has shown no evidence of an increased risk of pulmonary embolism, deep vein thrombosis, or thrombocytopenia in any defined age group, gender, batch, or any particular country." It is important to note that the number of cases of blood clots reported in the vaccinated group is much lower than hundreds of cases that would be expected among the general population. On March 16, the World Health Organization has reaffirmed that there is no link between Oxford AstraZeneca COVID-19 vaccine and blood clotting in patients. Lastly, I want to remind our general public that the batch that we are using in Dominica is a different one than the one used by the Europeans. In conclusion, the shelf life for this AstraZeneca batch of vaccines is limited, with an expiry date of May end. However, in order to give an 8-week interval between the doses, the deadline for first dose of this vaccine is March 29. So let us hurry up and let's get vaccinated. With this, I thank you.
Thank you so much to the national epidemiologist, Dr. Shalauddin Ahmeh. Again, 14 active cases here in Dominica, all of them imported. And as far as the numbers for the vaccinated population, 14,583, just a little over 30% of our target. Thank you again, Dr. Ahmeh, for your presentation. Next up this evening, we welcome with us the road manager and events coordinator for TK International, Mr. James Rodney.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade Wyke, Chief Medical Officer, Dr. David Johnson, Director of Primary Healthcare Services, Dr. Laura Esprit, National Epidemiologist, Dr. Shalauddin Ahmeh, media partners, ladies and gentlemen. Let me first thank the Ministry of Health, Wellness and New Health Investment for inviting TK International to present at this briefing. A few months ago, our very own cultural ambassador, Wayne Benjamin, was at this very podium, making a plea to our fans to take all necessary precautions to protect themselves against COVID-19. He reminded that it was important to wear your mask, wash and sanitize your hands properly, practice respiratory etiquette, and maintain social distancing. All of those things remain important. Keep in mind, wearing the mask is still the law, and proper hygiene does not have an expiration date. This evening, I am here to make yet another plea. In the past year, our livelihoods have drastically impacted by this pandemic. You know, perhaps even better than we do, the toll COVID-19 has taken. For some of you, you have lost jobs and your means of recreation, your CO. You have had to play the carnival live from years ago on repeat in your headphones just to get through this year's carnival holidays with no carnival. You have had to reminisce about your last jam, your last fete, and survive on those memories. We have seen the Facebook posts, the WhatsApp statuses, and the memes. That is something else, But let me assure you that we have suffered right along with you. TK International thrives on the live shows and the tours. That's how we make our money. And it may seem selfish, but we want that back. We want every income earner, whether in entertainment or tourism, to get back what they have lost. But on top of that, we want to get back to seeing the look of euphoria and pure joy that we bring to our fans when we perform. There is nothing like a live performance when you can feed off the energy of the crowd, and we want to get that back. By all accounts, right now, the only way that this is possible is for us to get vaccinated. That is the reality of our current situation. We cannot overlook it. We cannot ignore it. We cannot put our heads in the sand and think it will just go away. Our best chance to combat the spread of COVID-19 is for at least 70% of the population to take the jab. So we are appealing to everyone to visit your nearest health center, get your vaccine, take the jab. For the sake of your band, for the sake of your festival, for the sake of your carnival, for the sake of your tourism, for the sake of your families, and bring back real CO to the land of CO. Get vaxxed is there the sin be. Thank you.
And our thanks to the road manager and events coordinator for TK International, James Rodney. And of course, we want to thank TK International on a whole for being very supportive of the ministry as we continue to combat COVID-19. Next up this evening, we welcome to the podium the Director of Primary Healthcare Services, Dr. Laura Esprit.
To the Honorable Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade White, to the Chief Medical Officer, Dr. Johnson, the national epidemiologist, Dr. Ahmeh, and the road manager and events coordinator for TK International, Mr. Rodney, our media partners, person all listening, and of course, viewing public. Ladies and gentlemen, good evening. As previously mentioned, vaccination is one essential strategy towards decreased transmission and subsequent eradication of this dreaded COVID-19 disease. I'm sure we all agree. As you are aware, primary healthcare services, and by extension, the Ministry of Health, has begun a massive vaccination campaign, first of its kind, with unique characteristics amidst an ongoing pandemic. This vaccination campaign began on February 12, 2021, and continues aggressively to date, with the primary objective of vaccinating as many persons as possible in an effort to reduce the risk for the spread of COVID-19 infection on our island. As primary healthcare services continues on this vaccination drive, I wish to reiterate some important information for your benefit. Thus far, the campaign has been a successful one. However, the reality is that we are cognizant of the fact that there remains a level of hesitancy among our population, while some would prefer some further clarification in order to make a decision. At present, there are two available vaccines on island. We have the Oxford AstraZeneca vaccine and the Sinopharm vaccine. Very different, same cause. Fortunate for us in Dominica, we can name two vaccines, whereas there are many countries that are yet to name the availability of one. And because of that, we ought to be grateful. Now, again, what is a vaccine? A vaccine is a product that stimulates a person's immune system to bring about the person's ability to fight or prevent them from contracting a specific disease. In summary, vaccine causes the immune system to recognize disease, to produce antibodies, and remember the disease and how to fight it. So hence, vaccines are considered to be safe. And it's a clever way to produce an immune response in the body without causing illness. So it's a safe way. Now, due to the wealth of solid medical and scientific research regarding vaccines, it is therefore quite clear that the benefits far outweigh the risk of taking the vaccines. The target population for this vaccine campaign is geared at a minimum of 70% of the total population, and I say minimum. This is in an effort to achieve what we refer to as herd immunity, which is a form of indirect protection from infectious diseases that can occur with some illnesses like COVID-19. Now, this is achieved when a sufficient percentage of the population has become immune to an infection through vaccination, thereby reducing the likelihood of infection for those who lack immunity. Okay? Now, as such, this 70% allocation, the minimum that we spoke of, it totals approximately 50,400 persons who require vaccination so that we could achieve herd immunity. Let me just inform you on some of the strategies that have been implemented by the ministry to improve accessibility, and they are as follows. First of all, as you would recall, vaccination clinics began at our Type 3 health centers, and the Type 3 are essentially our bigger or main health centers per district. And this was done, you may wonder why, but it was done because it's a new vaccine, of course, and it was the most effective way to manage its administration, but that was at the time. Since then, a decision was taken to include our Type 1 health centers. The Type 1s are the smaller health centers, okay? And the main focus was to improve accessibility, particularly to our smaller communities. Concurrently now, the vaccination has been conducted or is being conducted at private homes to various homebound clients throughout the different communities. Obviously, if they're unable to get to the healthcare facilities, we have to go to them. And most recently, we've had a roving or mobile team now that is established to attend to clients at their points of work and the private institutions. So you've seen how we have moved on with an effort to improve the accessibility so that all can receive the vaccine. Our total numbers vaccinated thus far, as reported prior, 14,583. This comprises our totals for AstraZeneca at 14,257, with Sinopharm at 326 thus far. Again, there has been no reports of any severe allergic reactions with these numbers, 14,583. However, many people would have experienced some common side effects, such as pain at the site of the injection, chills, swelling. Some persons have reported fever, fatigue, headache, muscle ache, and some dizziness. And these are all documented as normal side effects, and it actually shows that the vaccine is working. Now, I wish to take you through 10 frequently asked questions so that we can provide you with the answers. Number one, what if I've already had COVID? Is there still a need to be vaccinated? And many persons ask that question, all right? The answer is that people who have already had COVID-19 disease, they're encouraged to receive or take the vaccine because the natural immunity is short-lived and immunization provides better coverage, okay? Number two, what if I have a weakened immune system? Can I take the vaccine? Well, individuals with weakened immune systems or other immunocompromised persons are at an increased risk for severe COVID-19 disease. As a result, these individuals are especially encouraged to get vaccinated. Question 3. If I receive a first dose from one vaccine, can I get the second dose from a different vaccine? And the answer is no. So if you start with Oxford AstraZeneca, you're expected to continue with Oxford AstraZeneca. Question 4. What if I take blood thinners or aspirin? Should I stop it before being vaccinated? Do not stop your prescribed medication. However, we wish to inform that there is a doctor available for consultation before actual administration. Okay? And of course, the medical team is right there. Question 5. Does the AstraZeneca vaccine cause blood clots? And that was alluded to by our previous speaker. But truth be told, while some countries have temporarily suspended the use of the AstraZeneca COVID-19 vaccine as a precautionary measure, based on reports of rare blood coagulation disorders in persons who have received the vaccines, other countries with the same information have decided to continue their vaccine program. Okay? Vaccination against COVID-19 will not reduce illness or deaths from other non-COVID-19 related conditions. So thromboembolic events, so that's the clots, just a big word for clots, they are known to occur frequently in the population, whether vaccinated or not. Venous thromboembolism is actually the third most common cardiovascular disease globally. So that's irrespective of taking the vaccine. Now, in extensive vaccination campaigns, it is routine for countries to signal potential, and that's the word, potential, adverse events following immunization. This does not necessarily mean that the events are linked to vaccination itself, but it's actually a good practice to investigate all of them. It also shows that the vaccination surveillance system is actually working and that effective controls are in place. Now, WHO is in regular contact with the European Medicines Agency and regulators around the world for the latest information on COVID-19 vaccine safety. At this time, WHO considers that the benefits of the AstraZeneca vaccine outweigh its risk and recommends that vaccinations continue. And of course, as previously stated, there has been no evidence to link the two, the vaccines with blood clots. Question 6. If I have severe allergies, can I take the vaccine? Well, it actually depends. We have the registration questionnaire, which covers numerous at-risk factors, okay? And again, there is a medical personnel on site for consultation on your unique circumstance prior to being vaccinated. So that's no excuse to stay away. Question 7. Will I get my vaccine certificate after the first dose? Maybe you have to travel. Unfortunately not. An official certificate will be issued after the second dose. Question 8. Is there a need to continue to adhere to the protocols after being vaccinated? Yes, as they all work collaboratively to protect you, your families, and the wider community. Question 9. Do I need to quarantine if I have been vaccinated? Yes, you would still need to be quarantined. However, the protocols are being reviewed and will be communicated to the public at soonest. Question 10. What if I am afraid of injections? Well, over the last few weeks, we know a lot of people, particularly our strong men, they are afraid. And that's okay. That's okay. We've seen it all. That's okay. Experience has taught us how to administer these vaccines to persons who are fearful. Most have reported that whilst panicking, they were actually unaware that the process was already completed. So test us out. Let's see if you're going to feel the injection. Now, in terms of announcement, this ends our part on the questioning. In terms of announcement, please be informed that the last date for the first dose of the Oxford AstraZeneca vaccine will be Friday, March 29, 2021, with absolute circumstances that will be extended up until Thursday, April 1st, 2021. Okay? Now, the second dose will commence on Friday, April 9th, 2021, and will continue until Thursday, May 27, 2021. Individuals who have received the vaccine on February 12, 2021, and given an appointment for the second dose on March 26, 2021, please be advised that your new date for the second dose is April 9th, 2021. So that those are for persons who actually received it on the first day, February 12th. Okay? Now, this change was made after consultation with WHO and PAHO, as primary healthcare was instructed to give the extended timeline of 8 weeks rather than 6 weeks to obtain maximum benefits from the vaccine. So I hope that's clear. But of course, if you have any concerns, please feel free to contact us at any of our healthcare facilities. Now, please be informed, too, that vaccination clinics will continue island-wide for the 2 upcoming weekends, both Saturdays and Sundays, from 9 a.m. to 3 p.m. For persons in the Roseau Health District, this will occur at the All Saints School of Medicine, situated in the central part of Roseau, of course. Now, during the course of the week, the Roseau Health Center, like other health centers, will also be opened to accommodate you. In addition to the Prevost Cinemall, which will be open specifically on Monday, March 22 and Thursday, March 25. But that's specifically in Roseau for all those who are interested. On this note, everyone is encouraged to get vaccinated, as this is a prerequisite to returning to a semblance of normalcy as relates to our businesses, travel, economic activities, festivities, personal and other pleasurable pursuits that we enjoy. Please remember, too, that your decision to be vaccinated is the key to protecting yourself, your families, your communities, and of course, by extension, the country. And please remember that the Ministry of Health remains committed to providing you with a vaccine service that is second to none. Last but not least, kind commendation goes out to the hardworking staff of primary healthcare services, which is supported too by the staff of the Dominica China Friendship Hospital. Your dedication and relentless endeavors, commitment on the weekends, the weekdays, even when called upon, the support of the EPI manager, all of you, the various categories of staff at these levels, We appreciate you. We appreciate what you do. And we're thankful for all that you do throughout this pandemic. Thanks.
Thank you so much to the Director of Primary Healthcare Services, Dr. Laura Esprit. And I'd like to echo her sentiments and really applaud, actually, the primary healthcare service staff and the staff at the Dominica China Friendship Hospital, and you, Dr. Esprit, for your leadership of this rollout of the COVID-19 vaccine. And thank you for answering those burning questions that many people have. But let me remind everyone that if there was a question that wasn't answered, feel free to call our hotline. The hotline remains open, available to you 24 hours, 448-2151, 448-2153, 448-2156, 611-4325, or toll free 1-800-219. And now we welcome the Chief Medical Officer to the podium, Dr. David Johnson.
Thank you. Thank you very much, Ms. Harry. Let me recognize the Honorable Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre, our Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White, our Director of Primary Healthcare Services, Dr. Laura Esprit, our National Epidemiologist, Dr. Shalauddin Ahmeh, Road Manager of Events Coordinator for TK International, Mr. James Rodney, you, the listening and viewing public, ladies and gentlemen, good evening. The Ministry of Health, as you have heard, is following very closely recent concerns raised, at least in the international community, about the blood clotting events surrounding the AstraZeneca vaccine. For us in Dominica, Dominica's public health response to any public health issue is always guided by the best available scientific evidence. For us in Dominica as well, we continue to look to WHO, as you have heard, the Pan American Health Organization, the Caribbean Public Health Institute, and the global scientific community in general for strategic guidance for what we do here in Dominica. In an official statement put out on March 12th, the Caribbean Public Health Agency stated, and I quote, that it is aware that some countries in the European Union have suspended the AstraZeneca vaccination campaign as a result of reports of rare blood coagulation disorders in people who have received the vaccine. And as you have heard, this was only done as a precautionary measure while a full investigation is being conducted. The statement continued that it cannot be determined whether there is a link between the vaccine and the disorder that we described above, that you have heard from several speakers, Dr. Ahmed and Dr. Nest and Dr. Esprit previously. It's important to underscore, however, that the World Health Organization has a global advisory committee on vaccine safety, which constantly and systematically is responsible for reviewing any vaccine safety and signals and concerns related to the COVID-19 safety. The committee, that is the Global Advisory Committee on Vaccine Safety, is carefully assessing the current reports on the AstraZeneca vaccine. And as you have heard, that there is no linkage between what is happening in Europe with the AstraZeneca vaccine and blood clotting events. On March 14th, the AstraZeneca company also issued a statement which stated in part that a careful review of all the available safety data of more than 17 million people vaccinated in Europe and the UK with COVID-19 vaccine AstraZeneca has shown no evidence, and I repeat, as you have heard, no evidence of an increased risk of pulmonary embolism, deep vein thrombosis, or thrombocytopenia in any age group, gender, or batch of any particular country. The AstraZeneca vaccine has been granted marketing authorization or emergency use in more than 70 countries across 6 continents. The WHO also granted emergency use listing of the AstraZeneca vaccine in mid-February 2001. It is expected that the AstraZeneca will be available and used in around 142 different countries through what we refer to as the COVAX facility. It is important, however, to underscore that the batches used in Europe or the European Union are not the same as what is used in the Caribbean. In the Caribbean, there is the UK batch, there is the batch produced from the Serum Institute of India and also from Korea. And for us in Dominica, the batch of AstraZeneca that we have is from the Serum Institute of India. You have heard the figures, 14,000, as of yesterday, 14,583 individuals have received the first dose of the AstraZeneca to date. Anyone who has received any of the COVID-19 vaccine given Dominica, you're encouraged to report any adverse events following the vaccination to your healthcare provider or through the hotline. Within the Ministry of Health, we have established an electronic vaccine management system through which we are tracking and monitoring closely any adverse events of the vaccines given in Dominica. And this is being monitored and being tracked on a daily basis. This system, I should tell you, is in addition to our national public health and response system, which we have established since 2003. And through this system, our communicable disease surveillance officer, our infection control officer, and in fact, our entire health information unit, we are actively following up with all of the health districts and the accident and emergency department of the Dominica China Friendship Hospital to find out if anyone has reported to the healthcare facilities around the island with any complaint of severe side effects after receiving the vaccine. We meet weekly to review all the data. To date, as you have heard, we have no report of any severe side effect from the vaccine. And we're not talking, as you have heard, from the Director of Primary Healthcare Services, Dr. Esprit, we are not talking about the usual side effects like fever, chills, fatigue, feeling upset. Some people might vomit, get headache, and joint pains. The vaccine has been proven safe for patients with diabetes, hypertension, asthma, heart disease, cancer, HIV, AIDS, even persons with bleeding disorders, and those who might have stroke. To date, over 270 million doses of the COVID vaccines have been administered globally since the start of the pandemic, based on the data reported to WHO by the national governments. We report our data as well. And no deaths. There's a lot of conspiracy theories out there, but no deaths have been found to have been caused by the COVID-19 vaccine to date. Let me be clear. and to emphasize what I said already, but vaccination against COVID-19 will not stop deaths from other causes unrelated to COVID-19. Deaths from other causes will continue to occur, including after someone might have gotten the vaccination. But it does not mean that it is the vaccine that killed the person. The Ministry of Health and Wellness, New Health Investment will continue the national, we will continue the national vaccination campaign throughout the entire country. We are currently mainly focusing on giving the first dose, as you have heard, of the AstraZeneca vaccine to our over 18 years and older by March 29th. But soon, we'll also be fully, and I said fully because we have started to some extent with the Sinopharm, soon we'll also be fully rolling out the Sinopharm vaccine. Let me say a little thing about the Sinopharm vaccine. The Sinopharm was developed in China, and China has the experience of developing vaccine since 1080. It has completed phase 3 trial. The vaccine, that is the Sinopharm, that will be rolling out soon. The vaccine, biotechnology takes a more traditional route. It uses the entire inactivated virus. So in this regard, the novel virus that caused corona would have a hard chance of trying to escape this vaccine. That is, a variant escaping the Sinopharm will be very difficult. It's not impossible, but it will be very difficult. The Sinopharm vaccine has been approved for emergency use in China and dozens of other countries around the world. The Sinopharm is being reviewed for use by the World Health Organization, and a formal decision is expected anytime, in fact, before the end of March 2021. And we are happy that the Sinopharm can be administered, whereas the AstraZeneca is only administered for over 18 years and older. We're happy that the Sinopharm can be administered to our minors as young as 3 years old. We are determined, as you have heard, all of the speakers have said so before me, we are determined to reach herd immunity in Dominica by vaccinating at least 70% of the population. We really think that we can achieve this milestone by August this year. We are very optimistic, extremely optimistic, that Dominica can be one of the first countries to reach herd immunity. In the region, or the region and the world, they're looking closely at what we're doing in Dominica. We will be ramping up, as you have heard, the campaign by bringing the vaccines as close as possible to all of our citizens. So we're trying to reach our citizens where they are. Our health staff are tired, you have heard it, but we understand the need for Dominica to get back to business as normal, or rather as near normal as possible, to get the economy and livelihood thriving again. We really have no choice. We have to do it. We are calling on all our leaders. We are calling on all our leaders, whatever leadership position or influence you may have, to come on board in support of the massive vaccination campaign currently taking place in Dominica. Everyone has a part to play. We must not, however, drop our guards, as you have heard, with respect to our fundamental and some basic public health measures which worked and we continue to emphasize. The hand washing, as we spoke about, the use of 70% alcohol, wearing of masks, which is mandatory, you have heard it, and avoid touching your eyes and mouth. Cover your nose and mouth with your bent elbow and use a tissue when you cough or sneeze, and throw it away safely. And if you have fever, cough, and difficulty breathing, please seek medical advice. Finally, on behalf of the Minister of Health, I really wish to thank all of the dedicated healthcare staff who have been working tirelessly to roll out the vaccination campaign since it was launched on February 12, 2021. There is, for us in the Ministry of Health and for us in Dominica and for all of our stakeholders who have been working tirelessly, for us in Dominica, there is no stopping, no turning back. We are moving full steam ahead with the vaccination campaign because that is who we are in Dominica. We never give up. I really want to encourage everyone to get vaccinated and contribute in making history in Dominica, in allowing Dominica possible to be the first country in the region or even in the world to reach herd immunity. And I really want to thank you for your attention.
And our thanks to the Chief Medical Officer, Dr. David Johnson, for his presentation this evening. And like he said, we are pressing forward with our vaccination campaign. And with this in mind, I want to remind everyone that to facilitate you, we do have a website where you can fill in the questionnaire before you have your vaccine done. And that's vaccineregistration.dominica.gov.dm. Again, that's vaccineregistration.dominica.gov.dm. Of course, for those of you who may not have access to the internet, we will have forms available at the various locations, and there will be someone there who can assist you with filling out that form. A reminder that vaccination is available in all 7 of our health districts, so please avail yourselves of them. It is the responsible thing to do. Let me thank all our presenters this evening for taking the time to join us. Of course, our media partners for making this broadcast possible, and to you, the listening and viewing public, for always heeding the call by the Ministry of Health, Wellness, and New Health Investment. Get vaxxed. Good evening.